Welcome back. Heart disease is the #1 cause of death in the United States, killing 1 in 4 Americans every single year. The American Heart Association reports that more than 6 million Americans are living with heart failure, and there are 900,000 new cases that are diagnosed each year. Joining me today is cardiologist Dr. Daniel Bensimhon, and we're going to talk about the symptoms of heart failure and treatment options. And Chris Rice, his patient, has his own story to tell. Welcome.
Thank you. Thanks for having us.
Yes, thank you.
Let me start with you, Dr. Bensimhon. What does it mean when someone has heart failure, and what are the symptoms?
That's a great question, Audrey. Heart failure is a condition in where the heart just doesn't pump enough blood to the body to meet the demands of the body. So people get symptoms, they get short of breath, they get tired doing their everyday activities, and then many people also get swelling. They get swelling in their legs, they get fluid in their lungs, and many people, including Chris, get bronchitis type symptoms where they get this cough that doesn't go away and just persists.
Who's at risk?
That's a great question as well. I think most people understand that people who have uncontrolled high blood pressure, people who have heart attacks, people who have diabetes are at the highest risk for heart disease. But heart failure can happen to anyone. Chris was struck at age 36. His heart was struck by a virus and got very weak and sick. So we urge people that even if you don't fit the exact picture of what you think someone with heart disease should look like, if you have those symptoms we discussed, it's time to go get help.
And shortness of breath is one of those symptoms?
Sure, most definitely shortness of breath with your activities, not being able to do what you used to do, being more fatigued, noticing that your legs are swelling, or one of the telltale symptoms is when you lie back in bed at night and you just can't breathe. You have fluid in your lungs and you just can't get your breath.
In terms of treatment options, what are the standard options that people have if they have heart failure?
Yeah, there are a lot of treatment options. As you mentioned earlier, 6 million people in America have heart failure. Fortunately, 90% of those cases are treated well with medicines. There's a lot of recovery. We have some great medicines, and people can even recover fully. Unfortunately, there's about 5 to 10% of people, about 300,000 patients, who go on, like Chris, to develop advanced heart failure symptoms. And then we need to talk about things like heart transplantation and the new heart pumps, like the HeartMate 3 and other pumps.
Well, Chris, how and when were you diagnosed with heart failure?
Initially, my story started in 2002. When I was 36 years old, I developed a virus that attacked my heart, and my heart swelled up, dilated cardiomyopathy, and I spent 16 days in ICU at that time. And then after recovering from that, I got out and I lived pretty normal still with heart failure. Back then we didn't use the term as heavy as we do now, but I still lived with heart failure for 16 years, and then at the end of 2016 I started to develop those same symptoms that I initially had in 2002, the shortness of breath, the bronchitis, the coughing, heavy coughing, can't stop coughing, laying down, can't breathe. And those kind of symptoms, and that's when I was admitted back into the hospital again with acute heart failure and introduced to the pump.
Wow, that must have been pretty scary.
Yes, yeah, it's from 2002 all the way to 2016. It was pretty scary.
Dr. Bensimhon, Chris had a heart pump. What is a heart pump, and how did it work to basically keep him alive?
So a heart pump is what we call a left ventricular assist device, or an LVAD, and what the heart pump does, it's surgically implanted, so one of our surgeons will implant the device, the chest is open, and the heart pump basically piggybacks onto the heart. And so while the heart is pumping, there's more blood getting pumped around the heart to support or assist the heart. And Chris had one for about a year, and then was fortunate enough to be bridged to a heart transplant, in which he got a donor heart.
You've had quite a journey, Chris.
Yes.
When you needed the heart pump, how did you feel about having to make that decision?
Well, initially I really didn't know what the heart pump was. At that point in time in my life, I was really, really sick and really was not expected to live. But when the heart pump was introduced to me, it was a new concept to me. But also there was another gentleman that came to visit me who also had the heart pump already and was doing really well with it. So that was very encouraging to me, just to see somebody else surviving and living a normal life with it. And so after that, I was pretty much comfortable with the idea.
Doctor, what can patients expect after they receive a heart pump?
Right. You know, the first couple of months after surgery like this is a major surgery. The first couple of months, people really sort of struggle in getting back to themselves. But within 3 to 6 months, we really see people really start to blossom very quickly. And just as Chris did, by 6 months, you know, he was out playing with his grandkids, he was playing his music, and really get back not even to a better state, but they're better than what they were before they had the pump, and really return to this a normal lifestyle. And that's what we strive for. You know, we're striving to extend lives, but also to make them better and let people engage in the activities they want to do, not just hang on.
Well, Chris, you now have a new heart because you had a heart transplant. I hope this isn't a silly question, but what was scarier, the pump or the heart transplant?
Actually, they both have their own different. I was living with Abbott's heart pump. I was living so good at the time. When I got the call for the heart, I was like, really? No, not now. Not now, not now. I'm doing so good. But then I really thought about it, and I said, well, this is a gift, and if it was my time, it's my time. And so I did the full circle, and it's all turned out really great.
There are so many new advances in medicine and care, and this heart pump really sounds like it helps people to live full lives even though they have heart failure.
Right, you know, and I think that's an important point. You know, about a third of the patients, or a little bit more, who get the pump actually go on to get a transplant. But there's a group of patients who aren't eligible for transplant but can still benefit from a heart pump and still get that return to quality of life. They can get extended lifespan. You know, the average survival on this pump is well over 5 years now, and we've had people out to 15 years. So, you know, if people are having symptoms, they're not getting better. There are 200 centers now across the country that are doing these pumps. And if you're having these symptoms and you're not getting better, you know, we really encourage people to ask their doctors to talk to them about, and would I be a candidate for some of this technology? There's a great resource on the web. There's a website called heartmate.com. Gives you a lot of background about heart failure. Gives you background information about the pump, and there's a great video about Chris as well.
Dr. Bensimhon, thanks for the information. And Chris, thank you for sharing your story.
Thank you.
Thank you.